As a physician, I'd like to share some good and bad news about COVID-19. Let's get the bad news out of the way first. The virus is undoubtedly taking its toll on many levels, and it's making it really hard to know what to do when we need to see our doctor. The good news is that we're finally entering the home stretch, with new vaccines that can help us get back to life as usual. The question we must ask ourselves now is how can we receive the best and safest care until vaccines become widely available? Please consider my 4 suggestions. 1. If you think you have COVID symptoms, don't hesitate to call your doctor's office immediately. They have the latest information on how to best manage your symptoms and get tested. Your doctor can also perform a remote or telehealth visit. If you don't have a smartphone, a regular telephone will do. And remember, don't go to your doctor's office without them instructing you to do so. You don't want to expose others unnecessarily. 2. It's obvious that the medical or behavioral health conditions you were treated for in the past did not suddenly disappear with the COVID national health emergency. Specifically, do not miss your scheduled appointments, but rather ask your doctor's office to conduct them remotely. Ignoring these ongoing conditions could actually be far more dangerous than COVID. For all other potentially serious emergencies, act immediately. Don't avoid the emergency room for fear of infection. Some examples to keep in mind are severe chest pain, difficulty breathing that doesn't improve, sudden weakness, numbness, or dizziness, or passing out. The number of possibilities is considerable. Call your doctor's office first if you have any doubt. However, the bottom line is you must not wait to get treated. And number 4, be careful. Wear your mask, socially distance, and wash your hands thoroughly. And if you're asked to see your doctor in the office, take all necessary precautions. Don't hesitate to ask your doctor's staff any questions before a visit. And if you are to be seen in the office, don't bring a support person and unnecessarily expose them. To summarize, ask for telehealth remote visits whenever possible. Do not miss follow-ups for ongoing conditions, and never hesitate to go to the emergency room when the need arises. And always remember to use your good judgment and contact your doctor's office for questions or concerns. And finally, when COVID infections are on the rise in your area, stay home as much as possible and stay healthy.